In this video, I'm going to talk about cause and effect in the phenomenon of muscle-based pelvic pain. What really makes a difference in the journey of healing pelvic pain is seeing when you are doing something that really helps your symptoms. When I was symptomatic, I tried all kinds of things: acupuncture, supplements, reflexology, certainly medications, spiritual healing. At that time, if you asked me if those things helped, I would have said, I don't really know. I've come to understand that if the answer to the question is something helping your symptoms, I don't really know, then it probably is not helping. You really do know when something is helping. When I was in pain, I dreaded trying something new to help myself because I had had the experience of trying new things and being disappointed when they ultimately failed to help me. I think that disappointment is an underrated suffering. In myself and in my patients, I see that feeling the hope of help and then being disappointed at the failure of what you have hoped would help you is a very bad feeling and something that many of us try to avoid at any cost. When our patients experience improvement, they dance. They say, wow, gosh, amazing. They were genuinely surprised that something worked. Their energies changed. They moved around and exclaimed, I feel better. You know when something helps. The mental and emotional space around someone who has had pelvic pain and experiences something that they have done that has helped them reduce or stop their pain is a wonderful space to be around. Most of the time when people have pelvic floor dysfunction, they see little relationship between what promises help and any real improvement in their symptoms. Our patients tend to be intelligent, conscientious, and accomplished, keen to find the relationship between their symptoms and the real cause of their symptoms. Most importantly, they see no solution to their pain and dysfunction. Not infrequently, our patients are scientifically inclined, who sometimes keep charts and records of any relationship between their symptoms and what they eat, when they void, when they go to sleep, and a variety of other things. Yet most people feel little ability to identify the factors that really move the needle in improving their problem. They will look for some kind of food, activity, supplement, something that correlates to the flare-ups they have or to the symptoms themselves. Not being able to see cause and effect has large consequences psychologically. It is greatly distressing not to be able to find a relationship between what really helps a condition that is going on. A large part of the suffering of pelvic floor dysfunction comes out of this uncertainty of what the problem is, of often not being able to see a relationship between something that makes it worse or makes it better. In a word, the distress comes from the helplessness of really understanding why the problem exists or what to do about it. It is from this helplessness and inability to see the cause and effect that people catastrophize, that they feel lost, worrying that they will never get better, that their pain is out of their control. But when you do find a relationship between cause and effect, especially when you see yourself being able to do something that routinely helps you, it's a game changer in your life. Not surprisingly, such a discovery tends to stop catastrophic thinking. When you see that there is something that actually helps you and actually does something for you and moves you in the direction of healing, catastrophic thinking typically disappears. I've always said that being able to help yourself is the great antidote to catastrophic thinking. There are different ways someone might experience this glimpse into a relationship between the cause and effect in their symptoms. It might be that someone will say, my wife got angry at me and I felt an increase in my pelvic pain. Such an awareness in that moment makes a big difference because they could see in that moment the relationship between their stress level and their pain. Sometimes someone experiences a worry being taken off of them and their pain goes away. Oftentimes, the readers of our book, A Headache in the Pelvis, have remarked that they feel better after reading our book and their symptoms seem to ease, as they would say it was the first time that they read something that intuitively made sense to them, that they could relate to in terms of cause and effect of their condition. What is the cause and remedy for pelvic pain in the view of those of us who train patients in the Wise-Anderson protocol? We know it isn't drugs or surgery or procedures or supplements. We published an article in the Gold Journal of Urology recently stating that prostatitis in men, which we are clear is mostly pelvic floor dysfunction, is a psychoneuromuscular disorder involving sore, irritated pelvic floor tissue, the result of anxiety-related chronic guarding in the pelvic muscles, held in the grip of chronic reflex guarding that prevents the sore tissue from healing. Supporting the healing of the pelvic tissue is the answer to this disorder in our view. The methods of the Wise-Anderson protocol for pelvic pain are both intuitively and not intuitively obvious. We teach our patients how to loosen the sore, tightened tissue between their breastbone and their knees regularly, while practicing a method that allows the sore tissue to heal and rest. One of our early patients said that the most memorable moment in his recovery from his own pelvic pain was not when every little sensation of discomfort finally disappeared, but when the pain would flare up and he would not at all be concerned about it because he knew he had the ability to calm down the flare-up. Having the ability to identify cause and effect in your pelvic pain and being able to do something that can reduce or stop your symptoms in the moment is a huge moment and is in the direction of the symptoms healing in muscle-based pelvic pain.